Hello, my name is Johnnie Nichols. This is class CNS 522 with Dr. Watson, and I'm talking to you today about the mental health effects on low income juveniles in the juvenile justice system and an exploration of needs, barriers, and interventions. The impact of low income juveniles' mental health on the legal system highlights the crucial relationship between mental health and socio-economic inequality. These youth who are already dealing with the financial difficulties also have to deal with mental health problems as a result of joining a system that is not set up to help them. This population has a much greater prevalence of diseases like anxiety, depression, and PTSD, which is always made worse by the harsh conditions in detention facilities. The introduction lays the groundwork for a discussion on the critical systematic changes that are required to address the underlying causes of juvenile delinquency in low income groups and to offer adequate mental health support. It is important to concentrate on low income neighborhoods when examining the mental health effects of juvenile justice system involvement on low income individuals because the research has shown that relocating from high poverty to lower poverty neighborhoods significantly improves the physical and mental health as well as the happiness of low income adults without necessarily improving economic self-sufficiency. Now, this suggests that neighborhood income segregation, which has been rising over time, has a significant impact on low income families' well being and highlights the significance of resolving residential and economic segregation in order to enhance mental health outcomes for vulnerable populations. Here is a brief overview of the juvenile justice system. The prevalence of mental health issues is estimated to be 70% among youth in custody, with many of them dealing with trauma, anxiety, or depression. When left untreated, many illnesses can have a suicide-related effect. Disparities and lack of access. States differ greatly in how they provide mental health treatments. With some states and rural areas not having enough funding, juveniles from low-income families are especially impacted by the inequality since they may not have access to the required rehabilitative programs. Systematic reform is needed. Proponents deemed that the juvenile justice system be changed to address the underlying causes of behavior and complete mental health services, but screening practices and treatment plans and assistance with reintegrating this in society are all a part of the juvenile justice system needs. So what's the setting and population? The juvenile justice system is characterized by its emphasis on rehabilitation but frequent lack of resources for criminal health care. Background and demographics: many come from low-income minority areas where they are subjected to violence, instability, and restricted access to health care. The prevalence of mental health issues is high among young people, with systematic pressures and a lack of assistance exacerbating the symptoms of despair, anxiety, and PTSD. What are more existing needs? The need for mental health assessments and personalized treatment plans, and the importance of supportive services. It is impossible to overestimate the vital importance of mental health evaluations and individualized treatment plans for low-income people involved in the legal system. Early and precise mental health examinations can pinpoint specific requirements, facilitating the creation of individualized treatment programs that tackle each person's particular set of problems. This strategy is necessary for a successful intervention that can lower recidivism rates and promote better results. Additionally, the provision of educational, social, and psychological supportive services is crucial to the comprehensive rehabilitation of these young people. While social assistance can handle the underlying socioeconomic problems causing their circumstances, educational support aids, and bridging the gap in learning interruptions. Therapy and counseling are examples of psychological support that helps with healing and resilience building, both of which are important to overcoming the obstacles of reintegrating into society. These services, when taken as a whole, provide a thorough support system that attends to the various needs of low-income juvenile offenders in the legal system, highlighting the need for a reform that incorporates these components into the juvenile justice system. What is the impact of public policy? Case studies highlight the impact, such as recidivism has significantly decreased and mental health outcomes have improved since the Cook County Juvenile Temporary Detention Center in Chicago adopted a model program that integrates mental health care inside the juvenile justice system. This achievement emphasizes how crucial it is to give integrated care models specific financing and legislative support. Number two, through the expansions of programs for at-risk kids, the Mental Health Programs Act in California, which is financed by a tax on millionaires, has shown how creative funding mechanisms can improve low-income juveniles' access to mental health care. These emphases are potential benefits to ensuring access to comprehensive mental health care and underscore the urgent need for tailored policy financing situations to address the mental health care needs of low-income adolescents involved in the criminal justice system. What do we need? We need evidence-based practices. Leading breakthrough initiatives created for low-income communities are now essential to reducing the negative impact of the legal system on young people's mental health. In order to close the service gaps, community organizations and nonprofits must launch focused programs to offer easily accessible mental health care, support networks, and rehabilitation plans. Programs that prioritize mental health and overall development, such as the Youth Empowerment Project, provide education, employment readiness, and mentoring. Comparably, the Juvenile Detention Alternatives Initiative, JDAI, of the Annie E. Casey Foundation seeks to lower the number of juveniles in detention while also enhancing the care provided to those who remain in the system, including mental health treatments. Interventions and services delivery. Personalized treatment plans and integrated trauma-informed care are the main focus of evidence-based strategies for treating mental health disorders in the juvenile justice populations. The complex needs for these young people have been successfully addressed by programs like multi-systemic therapy and cognitive behavioral therapy, which not only concentrate on the person but also includes their families and communities in the therapeutic process. Community-based interventions such as Healing Communities concept, which strives to enhance access to mental health care and lessen stigma through local partnerships and education, are examples of initiative programs aimed at low-income neighborhoods. Community organizations and nonprofits are essential in filling the gaps in mental health care available to underprivileged juvenile offenders. They can accomplish this by offering crucial services like advocacy, social support, and counseling, frequently filling in the gaps left by insufficient state programs. To address the needs of these populations, these organizations play a crucial role in coordinating resources, spreading awareness, and putting community-specific solutions into practice. Here are recommendations for policy and practice. To improve low-income juvenile offenders' access to quality of mental health care, it is imperative to employ multi-faceted techniques to remove current obstacles. One of the main recommendations is to give more financing for mental health services so the institutions inside the legal system have the means to offer all-encompassing care, incorporating evidence-based interventions, specifically designed for the demographic and providing personnel with training on the distinct mental health care needs for juveniles can improve the quality of services. It takes community education programs and the encouragement of mental health literacy among young people and their families to remove obstacles like stigma. It is critical that stakeholders, which are politicians, mental health care specialists, community organizations, and the legal systems, work together. These organizations can create integrated care models that address the mental health requirements as well as the socioeconomic difficulties that low-income juveniles encounter by combining their resources and expertise. Good cooperation also guarantees that adolescents leave the court system, receive continuous care, and that regulations are based on best practices. This all-encompassing strategy emphasizes how crucial it is to see mental health services as an essential component of a comprehensive support network for young people who are at risk rather than as a standalone offering. So what's the conclusion? Here are the summary of my key points. Critical vulnerability. Because of structural hurdles such as inadequate access to mental health care, exposure to violence, and socioeconomic instability, low-income adolescents involved in the juvenile system are particularly vulnerable to mental health care difficulties. These stressors of their surroundings and the contacts with the legal system aggravate a high frequency of mental health disorders in this population, including PTSD, anxiety, and depression. And there's also an impact on public policy. Reform is urgently needed since current laws frequently fail to give these young people the assistance to access to mental health care that they require. There's also treatment obstacles. Difficulties include incorrect diagnosis, social and cultural hurdles, and a dearth of specialized, culturally sensitive care. We need effective interventions. Innovative community programs and evidence-based approaches are viable avenues for addressing these mental health issues. We can't do this alone, though. So there is a call to action to policymakers. We need to adopt and encourage laws that enhance funding for mental health treatments in the context of the juvenile justice system, making sure that these services are equitable, accessible, and sensitive to cultural differences. There's a call to action to therapists. We must adopt evidence-based strategies with an emphasis on thorough assessments and individualized treatment plans that are especially intended for young people from low-income families. There's a call to action to community leaders. Encourage collaborations with educational institutions, healthcare providers, and nonprofits to build a network of assistance that attends to the wide range of needs that these young people experience. To those listening to this presentation, it starts with us, friends, family members, policymakers, therapists, community leaders, everyone. A sustained effort from all facets of society is required to address the substantial and complicated mental health difficulties that low-income youth in the juvenile justice system experience. By taking on these issues head-on, we can open the door for juvenile justice systems that are more just, efficient, and compassionate, which will ultimately benefit vulnerable young people and their communities. By working together, we can change our system from one that marginalizes and punishes to one that heals and elevates. Thank you.